All right, guys. Hello, Nurse Abby here, and I have my husband, Chris. And today we're going to talk about just how much a medical parent already knows and maybe what they know but can't put in nurse lingo.
I'm positive I'm going to get most of these wrong.
I think you're going to get a lot right.
I don't know.
We're going to ask some questions. We're going to put some things in nurse lingo and see if he knows what they mean. We're going to see if he can put some things in nurse lingo.
I know, whenever you start talking in your nurse talk, I'm like, I have no idea what you're talking about. So,
But it's stuff you actually know.
okay.
So if you're new to this channel, I'm Nurse Abby, but first I was my medically complex daughter's caregiver, and you learn a lot of stuff. And then I went to nursing school, and I already knew so much because of her, but you have to learn the right terms. So now I'm Raylan's nurse, and I chart on Raylan, and all the time I write VS space WNL. VS space WNL. What does that mean when I write that?
VS space WNL?
Mm-hmm.
I have no idea. VS.
Why would I write all the time? I write this when I'm charting.
I mean, the only thing that I can even think that starts with V is the VNS. So, vagal stimulus was not
Okay, no.
listed.
So when I write VSWNL is vital signs within normal limits. That means nothing weird is going on with her.
No, I would never have gotten that.
So here's some more things. Would you know how to put in nurse lingo, she has a fever?
Temp 101.
That is definitely appropriate.
Okay.
That's definitely appropriate. I was looking for patient is febrile.
Febrile? That sounds like a cat is like being crazy.
Feral. What would I write if I want to say, this isn't Raylan, if I want to say the person knows who he is, where he is, what time it is, and what's going on? What would I say?
Patient is cognizant of everything.
That's pretty good. Okay, normally they would say this for if they knew. Goodness, you all right, Raylan? Like, let's say you like got knocked out really bad, and like you were coming to. Who are you? Where are you? What day is it? And then you heard them like do that on medical shows.
Mm-hmm.
Or like I remember seeing a friend getting checked for Alzheimer's, and they were asking him this in the hospital. Alert and orienting ×3. And then if they know why, they do ×4.
Okay.
That's a new one they added, is a ×4 now.
Yeah, no, I would never have gotten that.
Okay, what if I wrote in my notes, patient SOB?
That doesn't sound appropriate. Patient SOB.
You definitely could identify if a patient was SOB.
Well, yeah, you would. You would know.
Why would they write that?
Short of breath.
Yes.
Patient short of
See,
breath.
you got that one.
I forgot one.
Yes. Okay. What about HOB elevated to 30 degrees?
HOB elevated 30 degrees?
I definitely type that sometime.
30 degrees?
Mm-hmm.
30 degrees. So it makes you think of like her bed. Head of bed's 30 degrees?
Yeah. Head of bed elevated 30 degrees.
Head of bed? That sounds awkward.
I mean, that's the part of the bed that's elevated. The head of the bed.
Why not? Okay. I would just say the head was elevated 30 degrees. Head of bed? That sounds weird.
Yeah. Well, there's different, and I don't even know these. We had to learn all these positions. I should know them, but I don't use them every day. So when you don't use things, you forget them. But like travelers, semi-followers, there's different positions you can be in a bed.
Okay.
But I just put head of bed elevated 30 degrees off the up. Here's one I know you know. PRN.
Well, it means as needed.
Mm-hmm.
I don't know what that stands for.
The Latin's prorenata,
Okay.
prorenata, but yeah, we knew that. We knew that before we got Raylan, right? Because of Brookline. But we worked at a boys' home and they had PRN meds. What about NPO? You know that one.
NPO has something to do like not by mouth or something, not by oral, not per oral.
That's what I thought it stood for, but it's not actually what it stands for. But we know what it means. Nothing by mouth.
Nothing but
Don't give her anything in her mouth. It stands for nil per os is the Latin word.
Oh, okay.
And os is mean, I think, os.
Just like BC AD doesn't actually mean before Christ. It's like
Yeah,
a Latin.
Latin. So, but it means, I always thought nothing per oral, but that's not the Latin words, but it is what it means to it. Capital P, capital M, capital H, lowercase x. PMH, lowercase x.
PMH, lowercase x. The lowercase x makes me think of like times.
I feel like maybe in Brooklyn you might have used this. Did you ever see capital H, lowercase x? Do you remember seeing that?
Treatment plan?
TX is treatment.
I don't know them.
Maybe you saw this. Yeah, I did some case management with Brooklyn. You didn't. HX? Did you ever see HX on their charts?
Maybe, but
When you were reading their charts?
I didn't have to look at charts too often early.
Be a good thing to do when you're on night shift sometimes.
I mean, I would skim through things, but I didn't have to understand like
HX is history.
history.
So PMHX.
PM. Night history.
Past medical history.
Past medical.
Past medical history. Oh, I had to look this one up recently. I was filling out. So in nursing, when you chart, especially electronic training, there's a whole lot of like just tick the boxes. And I think I told you this, so you might remember. But one morning she was extra sweaty. Does it matter that all this noise is going on in the background?
We'll see.
Okay. One morning, sometimes she's extra sweaty. So when I was doing the integumentary system, which means, I'll just give you a hint, she's extra sweaty. Corey, I think, would know this because he just took A&P, integumentary system. I might be saying that wrong. Skin.
Okay.
There's boxes, dry, intact, red, blah, blah, blah. She was extra sweaty and kind of like hot, and her temperature was a little bit elevated. But do I click diaphoretic or clammy? And what is the difference?
I mean, clammy sounds right.
You've heard of diaphoretic?
No.
Okay, so maybe I just picked that one up along nursing school. I knew it was one of them, but I didn't know the difference.
Clammy sounds right.
So it wasn't clammy.
Oh.
Why do you think it wasn't clammy? She was hot and sweaty. Clammy's cold and damp skin, and diaphoretic was hot and sweaty. So I didn't know the difference. Actually, asked ChatGPT. I use ChatGPT a lot when I'm charting to ask the dumb nursing questions I think I should know, but I'm a baby nurse and there's no nurse around to ask. So the quickest thing I do is, if it's something simple like that, ChatGPT is going to get it right. And it was like diaphoretic means hot and sweaty, clammy means cold and sweaty. So, but okay, I think you might know this one. What's the difference between a tonic movement and a clonic movement? Just tonic and clonic seizures.
Right. So tonic is the first phase of the seizure and clonic is the second. But I don't think that has to do with that. Tonic is the it's the explosive first part and clonic is the repetitive second part. So maybe it has to do with that. Tonic is like the explosive and clonic is
supposed to be like the tense and clonic is the rhythmic jerking.
Right.
Yeah. So not all, you can just have a tonic seizure, just a clonic seizure. But yeah, Raylan's typically, her big ones start tense and then, yeah. Yeah, so you're right. It's not necessarily explosive, it's tense. You did good on that one.
You're not forgiving that part, Owen.
Bradycardia.
Something to do with the heart.
You know this one. You know it.
I've heard you say it before.
And you know when Raylan's having problems with this too. Even if you don't know the word, you definitely know it's
some fast heartbeat.
no, that's slow heartbeat.
Slow.
Okay, how about tachycardia?
Fast heartbeat.
Yes. Tachypnea.
Be fast.
Ha-
How do you breathing?
I might be saying that one wrong. It is fast breathing.
Okay.
Um, ta- wait, it's a slow respiratory. Oh no, it doesn't. They're saying is that true or false? How do you think you say that?
Yeah.
I feel like I heard them once at the doctor's office say she was techniptic,
Hmm.
techniptic, and I was like, "What is that?" And they're just like breathing fast. See, I still don't. Just so you know, if you're a nurse, if you're a seasoned nurse, you might think, "Oh, she's dumb. She doesn't know a lot." Well, I'm a brand new nurse. I've been a nurse. Well, maybe now 2 years, 2 years now. But I pretty much just had 2 clients, and one of them I only see every 60 days, and then I have Raylan. So yeah, if you're not a nurse, just know nurses don't really know everything. Like if you have an owie and you see a nurse and you're like, "Hey, tell me about this." I mean, if they work in the wound clinic, they might know way more than your average doctor. And um, if they work at an ENT, they might know absolutely nothing about it, and your grandma knows more about their wound. So depends on what field you work in.
Right.
So, and if you're an experienced nurse saying she doesn't know a lot, okay. Yep, you're right. Okay, 2 more. True or false? You should document auscultation findings in a respiratory assessment.
I mean, true.
Yeah. I don't know how you say that word. I think it's auscultation.
I mean, I have no idea what that means, but it sounds like something you should document.
It's your lung sounds.
Okay.
What is a sphygmomanometer?
That's a blood pressure cuff or device.
Yeah.
Sphygmomanometer.
Sphygmomanometer.
I could say better than you.
We had a pronunciation test as part of our nursing is we had to be able to say words correctly. And I haven't had to say some of them in a while.
I know that was one that you kept on trying to say during nursing school. So
Sphygmomanometer.
sphygmomanometer.
Sphygmomanometer. Nobody says that after nursing school. They just say get the blood pressure up. But we did have to say it for our tests.
Right.
Sphygmomanometer.
How did I do?
You did great. You did great. I think you did great.
Probably 50%. Tell me what my score was.
What does this mean?
That was already
+2 pitting edema in BLE. Put it in layman's terms.
I have no idea.
You know any of it? Edema? Edema?
No.
+2 hitting edema in BLE would basically mean their lower legs are really swollen.
No idea.
Pitting edemas were like when you poke on someone's leg, like it leaves a dent. A pisser, it's so swollen, like you could. Raylan doesn't have that. How'd you score? Did you get them all right? Did you get a bunch wrong? Are you a nurse that got some wrong? If you are, that's totally okay. Are you a nurse that got them all right and thinks I need to go back to school? That's okay too. Are you a medical parent who did better pronouncing those words than I did? You should go to nursing school. You could do it. Thanks. Thanks for playing along with us, guys.